I believe it is more correctly stated that people are dying with a positive PCR test, not because of the positive PCR test. You can see my interview with Dr. Klaus Kuhnlein where he explains this PCR pandemic. There is also evidence of mass reclassification of death from other causes than COVID-19, the vast majority having nothing to do with severe acute respiratory syndrome. Even orthodox virologists such as Hendrik Streeck conceded that the SARS-CoV-2 deaths in Germany were exclusively among old people. In Heinsberg, for example, a 78-year-old man with pre-existing conditions died of heart failure, and that without any lung involvement from SARS-2. Since he was infected, he naturally appears in the COVID-19 statistics. But the question is whether he would not have died anyway, even without SARS-2. The New York Post reported in April how Dr. Deborah Birx had confirmed that the US health authorities were classifying all coronavirus patient deaths as COVID-19 deaths, regardless of cause.
Other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that.
Additionally, state health authorities were encouraging doctors to record COVID deaths and providing large financial incentives for US hospitals to declare patients as COVID-19 patients, as Senator Dr. Scott Jensen exposed back in April. I'll link this video below, but here's a short section.
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms with pneumonia. We learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19.
Jennifer Cabrera is another brave woman who has been exposing death certificate manipulation in Florida. An example of a case she revealed was the following. A 50-year-old insulin-dependent diabetic man with no COVID-like symptoms who called 911 for chest pain. He went into cardiac arrest en route to the hospital and was resuscitated with multiple rounds of epinephrine and atropine. He had acute renal failure, and a CT of the head revealed severe cerebral edema. He tested positive for COVID-19 in the emergency room and died 2 days later. You guessed it, that was recorded as an official COVID death.